overview of the work that we do and what some of our philosophical beliefs are, and welcome any sort of feedback and information and comments from the group. So before we start, I'll just let Jean go ahead and introduce herself as well and share any comments that she has.
Well, good morning again, everyone. So you know me, I'm Jean McMahon. In my capacity at SPAN, I'm the Senior Director for, as Bob said, for state and local programs, but I also hold a bit of a larger position at SPAN, where I also oversee and manage statewide programs, the business aspect of the programs. I serve on SPAN's management team. I've been at SPAN for, 7 years now. That went by pretty quick. I also serve on the New Jersey Statewide Network for Cultural Competence Leadership Council as the vice chair. So Carolyn and I are happy to share with you what we do, a little bit deeper understanding of what we do at SPAN and how our work at SPAN is very connected and coordinated with the work of the network.
Okay, so we'll go ahead and get started. And I probably should have shared a little bit about myself as well. I hate to give the numbers about how long I've been at SPAN, but I've been at SPAN for over 20 years and have recently assumed the position of executive director. But during my many years at SPAN, I've worked on multiple projects and both at the state and national level, and still currently serve as the director of a project that we have called the SIPR, which is the Center for Parent Information and Resources, under which we provide technical assistance to the 93 parent centers across the country. And so we'll talk a little bit today with you about some of the projects that we have. I remember fondly working with the network on several conferences over the years that were always a wonderful experience, and we always got such wonderful feedback from the participants. And so I'm so happy to be back in conversation with the network. Struggling a little bit to move my slides, but there we go. So today we just wanted to kind of give you this broad overview of who we are and talk a little bit about who our constituents are, which primarily families, but SPAN, really we work with everyone. And as you'll notice in our logo in the upper right corner, it is a bridge, and that is what we consider ourselves, a bridge that is connecting families to information, resources, professionals out in the field that can serve them, other family organizations and community-based organizations. And really, we just, we want to be a one-stop for families. We want to be that place where families can come if they need assistance or have questions, and we can either answer or support them or answer their questions. And if we cannot, we can refer them to an entity that can do that. Our work really does have a local, state, national, and even international scope. And we'll talk a little bit about that as we tell you about some of the projects that we have at SPAN. So just to start, we wanted to clarify for you what our mission and our vision is. And primarily, we are all about empowerment, empowering families by making sure that they have the information and the support that they need to effectively collaborate with professionals who may be serving their families, but also to be able to partake in decision-making processes with regard to services or supports for their children or families. And so we are really focused on enabling families not for us to come in and advocate on their behalf, but rather to empower them to advocate for themselves. And we do a lot of work around parent leadership, trying to ensure that folks who are served by systems are actually at the table and being part of some of the decision making at the decision making tables regarding those systems. As we all know, those who are being served by the system know best really where the pitfalls are, where the struggles are, where the challenges are, and are more likely than anyone else to be able to offer suggestions about ways to improve the system. And all of that is done with the goal of ensuring that the families, the youth, the young adults, and children that we work with are able to grow up and become fully participating and contributing members of our communities and our societies. We're strong believers in inclusion, and we do a lot of work in that arena, and we'll talk a little bit more about that as well. So that is our overarching mission. However, we do have a foremost commitment to those with the greatest needs. And it is generally those children and families who may be dealing with issues such as poverty, discrimination based on many different things, race, sex, language. We do a lot of work with the immigrant community. We have several projects in which we are supporting families that may be served by or involved with the child welfare or juvenile justice system. And we're actually going to be starting a new project in a few weeks, supporting families who have children that are justice involved. And we're very excited about that. And we will have the opportunity to actually go into some of the facilities run by the Juvenile Justice Commission to work with those families as well as the youth to ensure that they understand the services that are offered by the commission, but how to access those services, how to get the support they need upon reentry. So there's a lot of components there, but that's a new initiative that we're about to start, and we're very excited about that. Geographic location is also an issue, as we all know. Your zip code often defines your life experiences, and therefore we have a special focus to ensure that we are meeting the needs of all of the folks across our state. New Jersey is a very diverse state, as you well know, and there are some remote areas and rural areas that oftentimes have difficulty accessing services and support. So we do make a conscious effort to reach those families. SPAN goes into the communities of the people that we're trying to reach, so we don't expect them to come to us. We make an effort to go into the community, partner with local entities that are serving families in those communities and work alongside them and in collaboration with them to provide additional supports to families. And any other special circumstances that families may need. One of the things that we tend to do at SPAN is we recognize that families don't come in silos. Often the funding that we receive is in silos, and you might get money to serve one need that a family may have. But generally speaking, families come to us and we unbundle all of the issues that they may be dealing with. And it is through that process that we learn where there may be a need for additional services or supports for families. And then we seek to find funding to address that need. We look for partners to collaborate to address that need. And in some cases, we advocate for policy change to address that need. And so our work is very, very much driven by the needs that are presented in our work directly with families. Also want to just highlight that all of our work is done with a through a social justice lens. We are a very diverse organization. Our staff is representative of the families that we serve. We have approximately 60 staff that speak over 8 different languages that are live across the state. So our main office is located in Newark, but we have staff in every county. Some are housed in the special child health offices. Others are in other community-based organizations, such as the FSOs, and other folks are working remotely from home. The critical, most important thing is that we have staff that are spread across the state in communities across the state where they can be easily accessible for families to reach, but B, that they can get to know the local community and build those relationships and partnerships that are really so critical in us doing our work. We strive to maintain an equity-focused work environment that has a culture of inclusion. We learn so much from our staff as well as from the families that we serve. And we know how important it is for families to see folks that look like themselves when they're seeking assistance. And so we have a very diverse staff and we are intentional about doing that and ensuring that is consistently increasing throughout the organization. We strive to ensure mutual respect and authentic appreciation for the diverse backgrounds that our staff represent. And we encourage them to share with us and their colleagues their beliefs, their different cultural backgrounds and identities as well, because we recognize that we all learn and are better able to serve families when we have that understanding. And that's why we so recognize what an important partner the network is to us. We work to ensure a safe place for folks to share varied viewpoints, to have difficult and sometimes challenging conversations, but we know that those need to be had if we're to do better, which is always our goal. We provide our staff with ongoing training opportunities related to the issues of diversity, equity, inclusion, and anti-racism practices. And they're ambassadors out in the community, and we have to make sure that they have the information that they need and that they are prepared to support families, but also to move forward practices and legislation when necessary that will support the families that we serve. And just making sure that we are allies, we're identifying other allies, and that we are building coalitions with other entities such as the network to further this goal of increased social justice. And really, this is a lens that really drives everything that we do, every decision that we make, every application for funding that we write. We're actually working on an application right now, and there are 3 communities that are going to be served. And one of those communities is Newark, which clearly has a much greater population than the other communities, but B, just more significant needs. And that has to be recognized and addressed as we're planning activities in the work. Otherwise, we are setting ourselves up for failure. So that's an area that SPAN really wants to shine a light on, particularly when we're working with other organizations and other agencies and entities to make sure that we're all recognizing these challenges and hopefully also looking through that same social justice lens that we do. Oops. So I just wanted to give a little bit of historical perspective. So SPAN has been around for 35 years. We just celebrated our birthday. We had a gala back in December to recognize this milestone. And we started in 1988 around a kitchen table in Westfield, New Jersey. And Diana Cuthbertson, along with two other women, they recognized the importance of their children who had significant disabilities being included and having the opportunity for an inclusive education. And that is what prompted them to write the first application for the Parent Training and Information Center, which was funded. And that was the first grant that SPAN received. And I'm proud to say we have consistently held that grant for the past 35 years. And it has been renewed every 5 years since then. And it is really the core of the work that we do, which is really ensuring that families know and understand what their rights and responsibilities are under the law. Um, that grant is particularly around special education, but making sure that families know what they're entitled to and know how to access those services, with the goal of increasing and improving outcomes for their children. Um, in 1993, SPAN held its very first statewide conference. It was called Sharing Good Ideas, and that was a really big event. We now have we hold a biannual parent leadership and advocacy conference. It's coming up in September. There'll be some information right after the 4th. We'll be starting to advertise and push out ticketing information so that people can join us at that event. And it typically, we have about 300 families, participants who attend. And the focus is all about ensuring that families are learning the skills that they need to build their leadership and advocacy skills. And it is helping them to learn about all of the systems that support families and serve families. So whether it's education, health, human services through the Department of Labor or juvenile justice, child welfare, all of these systems serve families, and it's important for families to understand how those systems function. It was in 1995 that SPAN welcomed Diana Autain as the executive director, and shortly thereafter, our offices were moved to Newark, where we still reside. And in 2013, Deborah Jennings joined Diana as our executive co-director. And over the 15 or 20 years since then, our funding has increased significantly under their leadership. SPAN is now, our funding is around $5 million a year. We have around 22 projects that we are funded under, and we'll talk a little bit more about those projects shortly. And most recently, as of January 1st of this year, I took over as executive director of SPAN. And so I am, as you can see, have big shoes to fill, but also you can see that SPAN has had long and consistent leadership, and we look forward to continuing to be able to do that. Okay. So overall, what is it that SPAN does? We get that question a lot, and I have to say we've been working on perfecting our elevator speech because it's very difficult to answer that succinctly. But our biggest goal is really to assist families, and we focus on making sure that they know and know how to access services. We do that by increasing their knowledge, helping them to connect with other families. We have trainings for them so that they can learn more about child development, to understand developmental milestones so that they can know and get a start early if there are issues that need to be addressed. We help them to improve their communication skills so that they can communicate more effectively with the professionals that they're working with, and most importantly, that they are equipped to participate in the decision-making process with decisions regarding their children, that they're informed, educated, empowered to be able to really partake in that decision-making process and take some ownership of that process. I want to, our big question that we are always asking, this is our flyer, it's always about looking for help, right? So if a family is looking for help, we invite them to contact us, because that's what we're here for. We want to make sure that families know we're here, that they know the ways that we can help them. I would ask you all to help us in partnership to be able to reach out and let families know about SPAN. Sadly, I still meet folks. I met a woman once whose child was about to graduate from high school, and she said to me, "Oh, I wish I had known about SPAN before." Child was graduating from high school and she had never heard about SPAN. So we still have work to do to disseminate information about our services and let folks know that we're here. And one easy way that you can do that is to join our mailing list. And you can do that by just texting your email address to SPAN. You just text the word SPAN to the number 42828, and that will get you started to start to receive our electronic newsletter and other announcements and action alerts, etc., so that you can be a part of our work. Resources, we have tons of resources, and again, the scope is broad in terms of who we serve, starting from individuals who are of childbearing age as well as those who are pregnant, families who have children from birth to age 26, with and without disabilities and or special health care needs. And that's an important clarification, oftentimes because our first grant was with regard to serving children with disabilities within the educational system. People do not recognize that we have grown and we really serve all children, all families, with a special focus on those who have special needs in the educational arena or those who may have special health care needs. However, we are open to supporting all families, including those families who are providing kinship care for their children. So we do a lot of work with grandparents. We do a lot of work with foster families, adoptive families, and so we want them to know that we're here for them as well. We work with families to help them grow to be family leaders in their schools and within their communities. And we have a variety of leadership trainings that we offer to support that effort. And most recently, we have started to work specifically with youth and young adults and their adult allies, and training others to become adult allies to that population. But we've seen a significant increase in the number of youth that have been accessing our services, and we are thrilled to see that. And certainly, we continue to work with and collaborate with professionals within the health arena, the education arena, really any professional that's interested in the healthy development of children, we connect with. So this is kind of a broad overview of the program areas at SPAN, and we call them our buckets. So we have about 22 funded projects that fall within all of these areas, or at least one of these areas, some in more than one. But these are kind of the buckets that drive our organizational structure. As you can see, it really does encompass families at all levels, from early childhood all the way up to youth and young adulthood, and looking for ways to engage families as well as making sure they have information about ways to access health and mental health services, which certainly we've seen an explosion in our phone calls where families are looking for support particularly around mental health issues. Certainly the pandemic was a challenge for all of us, but there are some families that are still really struggling to recover from the pandemic. And so the other thing that we've seen is not just an increase in the number of calls that we receive from families asking for assistance, but also an increase in the complexity and the intensity of the calls. And so that is something that we're also trying to work really hard to support families to make sure that they have what they need and that they can actually take that information and effectively use it. We provide individual assistance via telephone, email, text, in person, and we train folks virtually, in person, and we also have some recorded trainings available on our YouTube channel. So really, there's training and information available to families 24/7, recognizing that families all have different needs, and we want to make sure that the information is available for them when they choose to receive it. We do a lot of work around policy. We have our policy person is Peg Kinsell. She is quite often in Trenton. I'm leading the charge. We had a couple of our staff just down in Trenton for the New Jersey Alliance for Immigrant Justice on Monday, I believe, held their Trenton Takeover Day. And we had 2 staff who were there and participated, supporting that entity in getting some legislation passed to ensure that immigrants have the same, immigrant families have access to the same services and supports that really legislation that will make a significant difference in their lives. Just gonna try to go through. So here's just a quick overview of some of the work that we're doing around early childhood. Our staff person, some of you may know Deepa Srinivasavaradhan, who's done a lot of work in the early childhood arena. She is part of the CDC's Learn the Signs Act Early program, and she's also one of the ARPI ambassadors with the recommended practices. Does a lot of work with the Department of Children and Families, as well as the American Academy of Pediatrics. I don't know, Jean, if you wanted to share anything. I know that you and Deepa have worked very closely on a lot of these programs.
Yes, thanks, Carolyn. I would also add that Deepa is the program director for the New Jersey Inclusive Childcare Project, which promotes and improves early childhood inclusion of children with disabilities by working with parents and provider education. By providing resources, connection to resources, and technical assistance to early childhood providers. So this is a statewide project, again, that is funded by Department of DHS, Department of Human Services. SPAN has had this project for many years. I'm going to say at least 20. Carolyn, correct me if I'm wrong on that. And Deepa has been the project director and has really taken that project to new heights since under her leadership in the past couple of years. Not only are we working with childcare centers, but also with parents now, and really helping childcare providers to understand the importance of inclusion and in the early childhood arena. And Deepa has just been a real advocate at the state level as a parent lead for the Infant Child Health Committee, which is a DCF program, and many other initiatives related to early child health and research studies through Rutgers University and Columbia University. So we're lucky to have Deepa, and we're thrilled that our early childhood programs have become more of a sort of division of SPAN now, and is one of our real big bucket areas.
Absolutely. Thanks, Jean. Another big bucket for us is the family engagement arena. So we have several projects in that program area, and it's all focused on supporting the engagement of families to improve outcomes for students. And so Debbie Esposito leads that program area for us, has been working on our START project for probably 10 to 15 years now. And that project ensures that families really have an opportunity to have input on their child's education at both the local and the state level. They coordinate and train parent advisory group members, also known as CPAC, Special Education Parent Advisory Groups. They provide the training to get those groups started across the state. So every district is required to have a special education parent advisory group. And then they support and mentor the group leaders to ensure that the groups continue and move forward. And one of the goals of that group is to provide feedback and information, almost as an advisory to the local school district, to make sure that the needs and concerns of parents who have children in special education are brought to the Board of Education, district leaders, so that they can be addressed. And so that's a very heavy lift, because there are lots of over 700 school districts in New Jersey, and each of them being required to have a group. So getting that group started. That project developed a guidebook around starting a parent advisory group, which is now distributed on a national level. And so there's a lot of expertise with the staff on that project around starting and running advisory groups. They also have some funding to focus on early literacy strategies for families, recognizing that literacy is really the key to success for children, and starting early is going to improve those potential outcomes. And so they do a lot of work directly with families around early literacy, as well as working with school districts to ensure that they are engaging families in those conversations and supporting families around implementing those strategies. Inclusive education, you just heard Jean talk a little bit about that at the early childhood level, but this family engagement, there are several projects at SPAN that are focused on inclusive education. That's a core belief of SPAN, that children are more alike than different, and that children with disabilities who are included are more likely to have more positive and successful outcomes when they are educated with their non-disabled peers. And so the START project, as well as multiple other projects at SPAN, have a keen focus on inclusive education. The project also works very closely with the New Jersey Department of Education around New Jersey tiered systems of supports in each school district to ensure that families understand those supports. It's really designed to kind of intercept those children who may be on a path to failure and may need special education. It's looking at ways to provide early and intensive interventions to see if we can improve the outcomes for those students. One area of confusion that we work really hard to help families to understand is that they can access the tiered systems of supports and special education at the same time. There's no requirement that you wait, because time can be the enemy sometimes for our children. So we have to ensure that they can access these interventions and special education if that is what is appropriate for that student. And so all of this is collectively done under what we call the START project, which is engaging parents of students with disabilities. And through that project, they not only recruit, but they train and coach diverse parents of children with disabilities to participate in all of these activities that we just talked about, and with a particular focus on doing outreach in underserved communities. Um, Another big area is health and mental health. Jean, do you want me to start or do you just want to jump? Because Jean is our program director, our senior program director for our health project. So she's really the expert in that area.
So one thing I'll say, as you can see, as we're talking about these different big bucket areas, is that our program, we have relationships and funded relationships across systems, right? So our early childhood programs are funded primarily, in Department of Children and Families and Department of Health as well. Early family engagement, we have funding from Department of Education. Health and mental health, primarily through Department of Health, and other resources too. But and I think that that's something that we strive to do at SPAN, is to make sure that we are maintaining our relationships with our state partners, and that we are informing them as well as we move through these funded programs. So it's we have some very good relationships for many years, because we've had these programs are ongoing and evolving and growing. So in terms of health and mental health programs, we provide information, training, support for families with children and youth with special health care needs, sort of across all of our health programs. In individual assistance as well. This is something that is sort of embedded into all of our health initiatives. And we make sure that we have access, that families have access to health and social services. We bring together schools, families, communities to implement principles of coordinated school health. And we provide outreach. We have 2 outreach programs for New Jersey Paid Family Leave and Affordable Care Act enrollment. So how do we do this? So through, in terms of individual assistance, we have funding for 30 years, one of our oldest, one of the first funded programs from the New Jersey Department of Health, called Family Wrap. And these are some wraparound services for families who have children with special health care needs, families for whom their children are enrolled in the special child health case management units across the state. And at SPAN, we have family resource specialists who, as Caroline mentioned earlier, our staff kind of walks the walk and talks the talk. So all of our family resource specialists are themselves parents of children with special health care needs or disabilities. And so these are experts and trained intensively, ongoing training they receive to be able to support families for whom their children are enrolled in the special case management units across the state. So this is a grant from the Department of Health, Special Child Health Services Division, and we work in coordination very closely with our case management units and provide that sort of ongoing and continuity of case management for families. Case management units are since COVID are still not, they're open, but they're not seeing families in their units. So our family resource specialists are providing a lot of supports to families virtually still. And as you can imagine, this is complicated support, you know, when you're not sort of have that kind of face to face, and this kind of like parent to parent emotional support is really important. We SPAN also houses New Jersey's parent to parent program. This is a national there's a national initiative with programs in states across the country, and we have housed New Jersey's parent-to-parent program for some time now. Parent-to-parent matches parents who have children with a very specific special health care need or disability with another trained parent for whom their child has that same or similar disability. And it's really to provide that sort of emotional support and guidance that families need when their child is newly diagnosed, or, as Carolyn mentioned, you know, for that family whose child is graduating from high school and they're first finding out about SPAN. We can provide those supports for families. We recruit and train support parents of children with hearing loss. And so this is our very famous EDDY project. And I'm so happy. I don't know if Pam is still here. So Pam Asen, who was our previous project director for our early hearing detection initiative, funded by the New Jersey Department of Health Special Child Health Department. Pam has now moved on to work for the Department of Health and is actually our program manager on the EDDY project. Pam was instrumental in moving forward the state's and our vision to implement a deaf mentor program. And that's really just been a tremendous step forward in serving families with children who have hearing loss across New Jersey. Still a work in progress. We have a very small amount of money to do a lot of work in that area, but we persist. And then most recently, we have these two outreach projects, as I mentioned, for New Jersey Paid Family Leave and Affordable Care Act enrollment. And this is through a collaboration with Citizen Action, who is funded by the Department of Labor. So we're sort of a sub-grantee on these projects, and it's like a huge statewide outreach initiative. Ongoing. They just received their second year of funding. So we're excited to continue that work with them. I'll move on to individual assistance.
Thank you. Okay, individual. I was just saying bye to Pam, but it was so good to see her. So individual assistance, that is a very broad brush, because almost every project that we have, we are working with families on an individual level in some way, shape, or form. We have about 10 what we call FRSs, Family Resource Specialists, who are trained to provide families with assistance when they give us a call. There's some specialized individual assistance and support for certain populations, such as military connected families, families that may have some involvement with the juvenile justice system, or families that may be engaged in the child welfare system. So we work specifically around those populations that just present with some very specialized issues and concerns. In addition, we have a person housed at Hackensack University Medical Center, which is focused on the Autism Medical Home Project. And they're working also directly with families who primarily newly diagnosed families. The hospital has what's called the Institute for Child Development there. And so they are doing a lot of developmental evaluations. And so as soon as they are identifying children with autism, they are referred over to this family resource specialist who works with them on many levels, helps them to understand the process, helps them to navigate all of those new paths that are put in front of them, making the connection for them, as Jean just mentioned, to another parent that has already had the same experience. And so that's a great project that is really doing some wonderful things in terms of providing individual and very um, um, uh, detailed support to families. They're really helping them to kind of um, find their way on this new journey that they find themselves on. We do this through telephone calls. The warm line number is on the screen for you. We share information sheets, fact sheets, parent guides with them. We have what is also called SAVA volunteers, but I'm going to move along and tell you a little bit more about that when we get to the leadership development slide. So the second bullet speaks to SAVA. SAVAs are special education volunteer advocates. And these are folks that have gone through our SRP training, which is the first bullet. That is a 30-hour intensive training that families go through, focused on special education laws and regulations. And each of the people that go through that sign an agreement that they will volunteer for 30 hours over the course of the next year in exchange for this free training. And for those who are willing to go on for more training, they get an additional 15 hours of training to become a SAVA. And those volunteers actually go to IEP meetings with families. That is the most requested service that we receive, is families asking for someone to go with them to the IEP meeting. Unfortunately, we don't have the capacity to go with every single family that requests that. And so we have certain criteria for those families that may be underserved or may have just encountered extreme challenges with your school district, or may have a language barrier, or may in fact have a disability themselves. Those would be the folks that can have access to a SAVA that would actually go with them to an IEP meeting. Another leadership development project that we have is LEAD, which is the Leaders Empowered as Advocates with Dignity. And that project is serving families and individuals of childbearing age with a focus on targeting those populations that we know historically have been underserved or marginalized, or just have experienced disproportionate or negative health outcomes due to maybe their zip code or other social determinants that have impacted their health. There's a lot of training and support involved in that project that is led by Nicole Pratt, who's also very familiar with the network, has been very involved in our conferences that we've done in the past. And one of our big leadership development activities is our biannual conference that I mentioned before. So I just wanted to highlight for you that that will be coming up in September at the National Conference Center in East Windsor. And I'm checking my time. I think there's 3 more slides and we will wrap this up. We do, as I mentioned earlier, do some work on a national and international level. And so these are some projects where we're providing support to other family serving organizations across the country that are doing similar to work with that SPAN is doing, but really our focus is on lifting them up and expanding their capacity to serve families as well. And then we have a lot of training, which is under our parent and professional development umbrella. I think I've already mentioned to you that those trainings are available in multiple formats. They're provided in multiple languages, including not just training for families, but professional development options for school districts, community-based organizations. And we've also done some employee resource groups upon request. We've already talked about the policy and systems advocacy that we've done. So SPAN tries to have a voice when there are issues impacting families. And we, again, are doing lots of training, such as engaging diverse families in policy advocacy. or telling your story with families directly. And these are just some youth projects. Most are they're either at state or national level. I think the thing to highlight here is that we do a weekly youth chat and youth blog with young people. We've been doing that since the pandemic started, and we have several youth that are just regulars. They come every Wednesday. It's a half an hour, and it's an opportunity for youth to get together with other youth and just talk about what are some challenges that they're facing and ways that they can work together or brainstorm ways to address those challenges. And then I just wanted to share with you some of our impact, these by the numbers over the last year, the number of projects. So we have 22 funded projects, the program areas we just talked about, disseminated over 1 million pieces of content. And our feedback through evaluation is that 99% of the folks found that those resources were of high quality. We've spoken to 35,000 families through individual assistance, trained another 25,000. And our Parent Center Hub, which is the national TA center, over 1 million visits to that website. You can learn more about it if you visit our website and check out our annual report. You'll see a lot more detail about these numbers. And how do we make it all happen? We have a fabulous team. So this is our SPAN team, who are just truly committed to the organization and to the work. And so that is it. I do believe, I'm sorry, we went over time. But I hope you learned something new about SPAN today. If anyone has any questions, comments, concerns, feedback, we'd love to hear from you.
This is Bob. Wow, 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 wow. Just a phenomenal, breathtaking presentation. It's just so wonderful to see how SPAN has grown and the impact that it's having not only in New Jersey, but around the country. Maybe since we don't have too many additional people from outside, we can take another 5 minutes for questions or comments from others.
I have a comment and a question. This is Jackie, Carolyn, and Jean. I'm exhausted just reading those slides of all the work that you all do. I cannot tell you how long I have been involved with the network and never truly appreciated what it is you do. So congratulations and thank you. The slide that I'm most stuck on, though, is Carolyn, the one with the social justice lens. Really impressive. Yes. Am I leaning towards that because that's my area? Yeah. So my question to you and Jean is, what is fogging up that lens for you today? Biggest fogger?
That is a great question.
Loaded question, Jackie.
Yes.
Mm-hmm.
Well, for me, it is what's fogging up the lens is I'm constantly surprised on a daily basis, literally, with what families, youth have to deal with out in the world, and the perspective of some of the folks that I encounter. It's mind-boggling sometimes to just hear what comes out of people's mouth. So that's probably the biggest fog for me, just trying to wrap your head around people that are so far away from where we are. And then of course, trying to figure out how do you work with those folks? How do you get them to understand, to see, to recognize what's wrong with maybe some of the perspectives that they are sharing, and what are the benefits of us doing our work through this lens, and the impact to the families. What happens when we do and what happens when we don't? I mean, it's pretty clear, but so that's the biggest fog, the sheer the numbers of people that we have to convince sometimes, but also the just the dichotomy of the perspective of where they are coming from is sometimes really hard to grasp for me.
And you had mentioned your ask of everyone on this call today is, help us get the word out so that we don't have seniors graduating high school whose parents just found out about SPAN. Yeah. And I dare say that isn't that the struggle of all of ours, is that we have so many
Yes.
gifts here at this table and
That's
community doesn't know about it. So I'm so excited, first of all, for SPAN's fiscal sponsorship of us. And
We are.
it just is a perfect match, because everyone at this table, we just really need to elevate each other so that we can get all these gifts out into community and do it in a timely manner. So Carolyn, thank you. Jean, do you have something else fogging up your lens?
So, I think that our greatest asset is the parent voice, or the family voice, or the person with the lived experience. Their voice, their experience is our greatest asset. And so at SPAN, and I think through the network too, this is one of the things we have in common, is that our biggest goal is to elevate those folks, those people, us, right? And the voice of the voiceless, so to speak, to put it in a term. And so that's what we do. And that's what SPAN has been doing for the past 35 years. And I think we get better, we learn more, and we get better and better. We get better and better with it every year, but we have to, I think that the challenge for us is getting the folks the like-minded folks, our like-minded partners, to hear that family voice, to understand. I'm talking about like the folks who are, our partners in this, to hear that family voice and to understand what's going on sort of at the ground level. And, so I think that's one of our challenges, is to really, how do we project that in a way that where our partners can hear it, and it's not just SPAN, jumping and screaming from the rooftops, and how do we sort of almost professionalize the parent voice? And I think SPAN does that very well, very brilliantly, actually. As we have said several times throughout this presentation, we have 60 staff, and what is it, Carolyn? Well over 90% of our staff are themselves, parents who of children with special needs or special healthcare needs or disabilities, and so, and just parents, right?
True.
So
That's my own story. Most folks came to us for help and recognized the benefits that they received from that, and wanted to then in turn help others. That's really our story.
Exactly. And so I
Thank you.
think that can, I think that we get better at it. Obviously, look, Carolyn Hare is our executive director. So, Carolyn came, right? You came to SPAN looking for help. Yep. Over 20 years ago, and here you are today, our seated executive director. So I think we're good at it, but I think that there's still a lot of work to do in this kind of new environment world that we live in. So it's post pandemic, if you will.
Yes.
Thank you.
Now I can see people again.
Yes. Anybody else with any comments? By the way, before someone else says something, these slides, along with the recording, would be such a wonderful resource to post on the website, especially for people who were not able to attend. So that's something, if there's permission to do that at some point, I think maybe Nick and the website group could deal.
Absolutely.
Any other comments or questions?
I wanted to make a comment. So I appreciate so much the presentation. I actually was in a meeting just yesterday where just last night, where SPAN also presented on the services. So I appreciate all the work that you do in terms of, we do some also special ed. We represent parents in these kinds of cases. So, but again, the need is so great that it's wonderful for SPAN to be there to be an advocacy resource for parents and to help them self-advocate. So we look at SPAN as really a partner in this work. So thank you.
That's what we want to be. Thank you.
Anyone else? I think you can see how all of the programs and work so directly aligns with things that each of us, and the Leadership Council are involved in. And that's why it's been such a valuable relationship over the past 20 years, because SPAN helped us to organize our conferences. I will also say that SPAN people have come to the medical school, and the students and the faculty, hearing the patient's voice, family voices, consumer voices, that's what they remember, are those stories. I think people remember, one of my favorite quotes is that health statistics are people with the tears wiped off. And it's, we can look at the numbers and all of the other stuff, but that's a quote from the founder of the randomized controlled trial. And so I think that's at the heart of what we need to do. The professionals know some of it, but the real wisdom and expertise lies within the parents and the families. Be a little provocative, which sometimes I can be. Along with a foggy lens, I'm also worried about the cracked lens and all that. And I know that Jean and Carolyn, you've spoken about not all states are necessarily receptive to terms like intersectionality, right? And a lot of the language that is on these slides. And so the question becomes, how do you support the families or people who have different political views or ideological views on these subjects? And I think that's its whole big discussion. But along with the foggy lens is the cracked lens of social justice. Any thoughts on that?
Well, we hear about it all the time because we do provide technical assistance to other the parent centers across the country. And we are working with some other coalitions to, it's same as what we're saying here. We really do have to partner. All those of us who are like-minded doing the same work need to strengthen our ability to come together, because otherwise we're fractured and that makes the crack get bigger, right? Because we're not united. It's actually frightening sometimes when you get on those calls and hear what's happening in other states. I think another group that that is struggling a lot are the teachers who want to call in secret because they can't say certain things in the classroom and they're afraid for their jobs, their careers. One woman actually was fearful for her life. So yeah, it's dangerous for sure. But I do think that what we need to do more of, and we try really hard to do this, but not enough, is making those connections, right? Like, you're a network, we're a network. I think that's the key. Those lines that are connecting all the different components of our networks, we have to make sure that they stay strong and that they don't break. And it's hard. Everyone's overwhelmed and overworked and underfunded, and just it's quite a struggle. So recognizing that, but then trying to make that extra effort when possible to do what we're doing here today, which is to talk to each other and learn a little bit more about each other's work. And we'll carry that forward with us and hopefully be thinking about the next time I talk to somebody, I'll think about what you all are doing and try to make those connections. But it's hard, to say the least. It's difficult to do.
I'm sorry. So it's interesting. So again, like I was in another meeting last night and it was actually the audience was family members of children with disabilities. And they were discussing translating materials into Spanish. And one of the moms said, you know what, you can do all the translation that you want, but you need to be in the community and be engaged with the community, because they're not listening. They're not coming forward. They think they're not included in the conversation. Because I guess the discussion centered around inviting these families who are, non-English speaking to the table. And they were invited, but they said, you know what, my voice isn't heard. Nobody really cares about me because nobody's here in the community explaining to me what this is all about. How does this affect me? So and that resonated with me just based on what we're talking about here and just based on what the mission of the network is all about, inclusion. So, and I think that's so important. Like sometimes we forget that. right? Being in the community, and a lot we were talking about previously about outreach and education is so important. So and I'm going to take that back with me, because we obviously serve the same population. You know, we translate flyers and other materials into Spanish, but really being in the community and talking to the community and seeing what their needs are, and for them to really have a feeling that, you know what, people care about me. It's not just, oh, we're just kind of going through the motions and doing translation. So I just wanted to share that, because again, it came to my attention just last night when one of the mothers, Spanish speaking, who's also English speaking, brought that to the table and said, this is a problem that we need to address, that you need to be out in the community. I just wanted to share that.
Yeah, and it's a trust issue as well.
Well, exactly. So that's exactly what she said. She goes, it's a trust issue. There's mistrust in the community. So they're not at the table. You can translate all you want, but if they don't trust you, they're not coming forward. Right.
That's right. Yeah.
That-
And building trust takes a long time and a lot of energy.
Correct. And that's why the outreach is so important. The way you do outreach, the strategy behind outreach, you know, it's not the organization that does this outreach. It's the community members who need to do the outreach, and that's sort of embedded in all of our programs, across all programs, is to really build the capacity of community members to be the leaders and to be the spokespeople and to be those trusted community members, because that's who they are. You know, that's already their role. So certainly.
Oh, absolutely. And that's why there's so much discussion about community health workers.
Yes.
Being really involved in a lot of the work that we do with our partnerships, because yes, I agree, they're in the community and they should be doing or helping us doing this outreach, right? Getting the word out, really conveying the message that we want to convey.
Exactly. Community doulas, same thing.
Mhm.
That's their role.
So it's
Family
a good,
resource specialist. We call them family resource specialists at SPAN. We've been doing that for years.
so it was good thing that Kiva suggested we change our subcommittee to community outreach and education.
Absolutely.
That will connect that up. Well, thank you very much. You know, we will only have a little bit of time to review some of the Leadership Council work, but thank you, Jean. Thank you, Carolyn, for just a spectacular presentation and letting us all know what SPAN's important work. It's a good partnership. More to come.
It is. Yes, and we're looking for more. So thank you all for your time. It was a pleasure to be here, and enjoy the rest of your day and
You
the
too.
long weekend that's coming up, hopefully. So
That's
take
right.
care.
Happy
all.
Fourth.
Thank you again.
Carolyn.
Well, let's just transition. I noticed there were two other people who joined us. It's Mr. William Jakowitz, I don't know if I'm pronouncing your name, and Mary Knapp, if she's still on, and we welcome you. Did you want to say anything more, Jackie?
Sorry, did I want to say anything more?
Yep. Well, you had sent us a note about Mr. Jakowitz coming.
So yes, so I would like to introduce, and Bill, if you could come on camera, if you're not camera shy today, I would love to introduce you to the group. Bill Yakowitz has been a dear, dear friend of mine for quite some time, but we started as, shall I say, colleagues trying to get people with disabilities into training, education, and employment. And so I'm so happy, Bill, that you were able to join us. Would you like to introduce yourself real quick, Bill? He might not be able to join us audio wise, but further updates to come.
Good. And there's also a Mary Knapp. Welcome.
Thank you.
Welcome, Mary.
Thank you very much. I'm an old time participant in these activities. I'm retired now from the birth defects registry with the state, but Zenaida always invites me, and I like to keep abreast of what's going on. So thank you for having me.
Great, welcome.
Welcome. Thank you. We have a long umbilical cord, and
Yes. Thank you. Thank you, Mary, for coming to participate and support us in whatever way you can.
right. Is there anything else that folks would like to discuss off of the morning's discussion or of this discussion?
If I could, Bob, we see the value of sharing ourselves with the rest of the group and really learning from each other and teaching each other what we do. So I'm going to say, one, congratulations to all the new Leadership Council members. So welcome. We want to do that. We want to brag about you. We want to hear about you and learn about you. So if you are interested in being a presenter like Span was today, please let this be the formal invitation, right? Because there is so much to learn and we can't really advocate for each other if we don't really know what we do. So I just wanted to say that.
Thank you.
Thank you.
And that will certainly be one of the topics that I think will come up with the Community Outreach and Education Group when we meet next month, because it would be wonderful to have us hear from each other. Do we know what happened with Constant Contact? Because in the past, we've been able to send out a description of the webinar and attract other people from the broader network.
This is Jean. I think Nick was that because you were on vacation? Did that have something to do with vacations?
Yeah, that was the fundamental problem, that I was out of the country and couldn't prepare a Constant Contact announcement for this event. But we need to talk about Constant Contact and how it's managed, whether we link into SPAN or continue to operate an independent Constant Contact website.
Yeah, I think that, well, I don't know if we want to talk about it here, but I think that we should talk about linking it with SPAN's Constant Contact. And then that way, you know, we have SPAN's resources available to us, you know, like an administrative assistant, for example, if you go on vacation or something like that, Nick.
Exactly.
You can have someone else do it.
Great. Another thing that we sometimes do in these meetings is if people have questions or looking for other resources, we can do that. And Nick, you had called me yesterday about a question with immigrant healthcare providers, that physicians, nurses, others. Did you want to pose the question to see if anybody here might be able to provide some information?
Well, I'll try to simplify the question as best I can. I belong to a group called the New Jersey Business Immigration Coalition, and we sponsor something called the Garden State Immigration Policy Institute. We do that in conjunction with the New Jersey Business and Industry Association. Anyway, we are planning an event in the fall that will look at the human service needs of the healthcare profession, but specifically with a focus on immigration. And as you all probably know, immigrants are a very important component of the larger healthcare workforce. And many, many different occupations are experiencing shortages of workers. At any rate, this is all by way of saying that we're looking for people who have experience and expertise in this area that they would like to share with us. So we're putting together a panel of representatives from different healthcare occupations. And if you know of anyone that you think has devoted some attention to this issue and would like to participate in this effort, please let me know.
Great. Thanks, Nick. Anybody else with questions or information they would like to share before we schedule the next quarterly meeting?
Actually, Bob, I just remembered. So in our Zooms, if we could do a registration required, we would be able to collect everyone's information. So Jean, would we be able to just automatically check that off the on the Zoom meeting when you set them up?
You know, I I didn't see where I could do that. I know because I saw you sent it in an email, but maybe we can talk about it offline.
Absolutely.
I didn't, that's why I asked folks to put their information in the chat.
Yeah.
That's not always the best way to collect information if there's another way to do it through Zoom.
Yeah, because it will automatically build an Excel for us, an Excel sheet, so we can at least track who is here.
Okay.
So, but we'll do that. You and I'll do that together.
Okay, thanks. Thanks for that.
Great. So our next Leadership Council meeting is August 10th. We typically meet 4 times a year for the quarterly meeting. When would folks like to meet again?
Bob, not to create any confusion here, but I thought we were going to entrust the Community Education Committee to think about future scheduling rather than trying to do it at this point. So I would assign that responsibility to the committee and have them report back at our next meeting.
Okay. Do the other members, so Jean, does that work all right from your
Yeah.
standpoint?
Yep, I remember that as well. So.
Good. Thanks for the reminder. So we'll add that to the to-do list for our committee and propose something, either a doodle calendar or what on there. Okay.
Sounds good.
All right. Well, we are 3 minutes early. If nothing else, thanks to everyone for coming. Welcome and
Thank you.
congratulations again to the new Leadership Council members. Have a happy 4th of July and may the force be with us all.
Thank you, Bob.
Thank
Thank
you.
you very much.
Bye-bye.
Thank you. Bye.
everyone. Bye.
Jackie, do you want us, Jackie leave? Oh, she left. Okay. Thanks, everyone.